Welcome to Moi Teaching and Referral Hospital. Today, we are going to flag off a team that is engaged in patient safety, and they are going to various counties in the region because we feel that it is a high time that we move patient safety from MTRH to the counties. And I'm happy today I have visitors from Trans Nzoia also, Mheshimiwa Chemoz and Ms. Meto. They came here for a different reason, but they are also working within the space of assisting the communities. They have an NGO in Trans Nzoia that deals with, many issues, but for the purpose of today, MTRH is donating sanitary towels to Trans Nzoia County through their NGO. We are donating about 7,400 towels. I mean, not towels, but it comes in packages. So 7,400 packages, which will last for 3 months and will serve 12,000 children, 12,000 girls in the, young girls to the teenagers. So we are happy to have you here. Please feel welcome. And MTRH, led by Mr. Lebo, who is our patient safety coordinator, are going out to the counties really to talk about patient safety that is family-centered. We get patient safety through proper communication between the care staff, the healthcare staff, and the family. Nothing should be left out. The history should be complete between the healthcare staff and the patient and the family. Everything should be disclosed. And then when it comes to checking of patients, we normally tell our healthcare staff that they must check head to toe for the purpose of patient safety. Head to toe examination, thorough investigations in the laboratory, in the radiology, and any other, including social investigations. And when you are treating a patient, you have to check on them every day and see at least twice a day to make sure that the patients are safe. And we do not just focus on the technical treatment. We also focus on where, like where the patient is, if they are admitted. Are they safe? Can they fall off the bed? Can they fall off the roofs, and so on and so forth? So all these, patient safety is such a big thing, and all the drugs also that are given to patients, we have to check. Somebody else has to counter-check and be sure about the name of the drug, about the dosing, about the frequency, and how it will be the route of administration. And we have to check also on how the patient responds to the treatments that we are giving. When we are doing surgery, we have to be sure that we are doing surgery on the right patient, the right surgery, the right side of the body, to avoid any unnecessary or untoward complications. So this team will be, we feel that MTRH is safe, but we cannot be an island. As part of the bottom-up transformation agenda of government that has been, pronounced eloquently by His Excellency the President, we support it by supporting the counties also to make sure that patients are safe in the counties, including the environments, the cleanliness of hospitals, the cleanliness of laboratory facilities, all the equipment that are used, like the wheelchairs and what, they should be safe, the co-chairs, all these, including infection prevention and control, are areas also that we address when we are dealing with patient safety. But the bottom line is this: the communication must be family-centered, not patient-centered, but family-centered, so that the whole family is aware what is the diagnosis, what is the treatment, what is the prognosis, what is the way forward, what is the follow-up. So it has to be family-centered. And we are appealing to the counties and all other hospitals in Kenya and beyond that the hospitals that we run should be safe. We should have safe hospitals that are patient-friendly through proper communication and proper evaluation of patients. And we should never feel bothered as healthcare workers when engaging with the families. Above all, also, of course, we request the families also to give us full information, to walk the journey with us, and they should not just abandon patients on hospitals. Families also have a role to play when it comes to taking care of patients. They have a role in the sense that they have to give us full information. They have to be with the patient, even as the nursing and healthcare staff are with the patient, but the family has to be there also to walk the journey with us. They have to be there so that they can be updated on a daily basis on how their relative who is admitted or who is being seen in the clinic is doing. So basically, you can see it's a big discussion really. Any question? I will allow either Mheshimiwa or to say just Jambo from Trans Nzoia and what they are doing there, the name of their organization, which we are going to support, and what they are doing.
Okay, thank you. I'm Teresa Meto, the patron of the Greater Purpose Community Organization from Trans Nzoia, and we are grateful to be here today. And we are also grateful for MTRH for giving us a sanitary towel so that we can get to give to our boys and the girls in our schools, especially the day secondary schools back in Trans Nzoia. Greater Purpose Organization was formed some years back, especially during the COVID period. One is to cater for women in rural places and also the girls or the youth in rural places, mainly just for hygiene and food protection. So that's what we mainly do. And we are very grateful to Daktari here for joining us and also giving us the sanitary towels so that we can take care of these young ladies back at home. Thank you so much.